I'm with Dr. Longenecker today from Heber Valley Clinic. Thank you so much for being with us.
It's my pleasure.
We're going to talk about implantable forms of contraception like Implanon, Nexplanon. Tell us a little bit about what it is and how effective it is at preventing pregnancy.
So Nexplanon is the currently marketed device that's on the market. The Implanon has actually been removed from the U.S. market about a year ago or so. And so the Nexplanon is the device that we're using now. It's been refined and tweaked a little from the older device, and it's a little bit better and safer to use. Basically, it's a progestin-coated device that is implanted in a procedure right up here under your arm. And it can sit there for up to 3 years and give you the protection that you need for preventing unwanted pregnancy.
So one of the benefits is that you don't actually have to think about doing anything. You get it placed and you're done for 3 years.
Pretty much. The procedure puts the device in. However, I still counsel my patients to check on a regular basis just to make sure that the device is still where we put it.
So it can migrate a little bit.
There is a small risk that it could migrate to another location, but usually it stays put right where we place it.
And how effective is it at preventing pregnancy?
It's very effective, greater than 99% effective at preventing pregnancy. There are some side effects. Most patients experience a little bit of bleeding right after the device is placed. That's just to allow your endometrium, or this inside lining of your uterus, to thin out a little bit. It's going through some breakdown, and it might just shed a little bit more frequently than you're used to. But as time goes on, that should get better and better and better.
Do you usually have periods while it's in as time goes on, or do they stop altogether in most cases?
Most patients that I deal with still continue to have periods, but there are some where the device works well enough that they could stop having periods altogether.
Once it's removed, how soon can you get pregnant, or return to a fertile state, I should say?
So whenever that device is removed, there is the potential you could become pregnant right away. Most patients who have this sort of contraception in their body, usually it takes them a number of months to start having regular cycles again, meaning regular ovulation or releasing that egg from the ovary, regular periods. But as soon as that happens, you can become pregnant. Over the course of 1 year, about 75% of people do conceive who have previously been on this device.
So it's easily reversible?
It is reversible, yeah.
Okay, that's good to know, especially if someone's considering long-term versus short-term forms of contraception.
Right, and so this is a long-term form of contraception, again, good for up to about 3 years. One of the drawbacks is it does require a procedure to remove the device. Just like we had to place it, we have to remove it.
Right.
And that can be a little bit uncomfortable, but it's an in-office procedure, generally very well tolerated. We use a little bit of lidocaine to numb you up so it's not terribly uncomfortable, but it is a procedure to both place it and remove it.
Well, thank you so much. That's helpful information. Ultimately, anyone considering forms of contraception should talk with their doctor, and then they can give them tailored information and advice about what would be best for them.
Exactly. I think that's a great idea.
Hey, if you guys have questions in the future for me, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.